Okay, I think we are ready to start now. Welcome everyone. My name's Karina and I'm one of the Assistant Directors here at the Commission working on the development of Vision 2030. We're just about to begin, but before we do, I wanted to run through some quick housekeeping. First of all, thank you to everyone who completed our pre-webinar survey. That was very helpful for us in creating the content that you will see here today. Today's webinar will be recorded and uploaded to our website so that people who are not able to see can view it at a later date. I do, however, want to assure you that only the panelists and their audio will be recorded. And as audience members, you will be able to maintain total anonymity if that is your want. You will also note that there is a Q&A function down the bottom of your screen. If you have any questions as we go through today's presentation, please submit them here. It should look something like it does here in this photo on the screen. We have allocated time at the end of today's webinar for responding to as many of these questions as we can. And also, if you would like to remain anonymous but still ask a question, there is a checkbox that you can select to send them anonymously, which you can see here where my mouse is scrolling over. At the end of today's webinar, you will be asked if you would like to complete a post-webinar feedback survey. If you have the time, we would greatly appreciate any feedback that you have. And if you have any remaining questions, then we can do our best to ensure that they are answered through future communication channels. So without further ado, I'm going to hand over to our CEO, Christine Morgan, to kick off this, our first Vision 2030 webinar. Over to you, Christine.
Thank you, and can I just say welcome to everyone. I'm just going to try now to see if I can get some control of these slides. Karina, can you just, here we go. So I think I might be about to try and control it from here. So firstly, I would just like to say welcome to everyone and thank you for joining us today as we go through our webinar on Vision 2030. And this really, if we're going to be successful today, it will be that at the outcome of this, you will have a bit more of an understanding as to what it is we're trying to achieve. You'll understand how critical it is for us to have your input, and you will be looking forward to the next part that we can participate in. So just before I, oh, sorry, I can't. Let me just go back. Something is happening with our slides here. So, Karina, I might have to pass back to yourself, I think, for you to direct the slides. If we can go back to that first one, because I would just like to, before I get started, to acknowledge the traditional owners of the land upon which each of us are meeting today, right around the country, and thank you for wherever you're joining in from. I pay my respects to their elders past, present, and emerging. I would also like to, in particular, acknowledge those of us who have lived with mental health challenges, whether that be somebody who has challenges, we care for someone, we're impacted by somebody. Mental health, as we know, affects so many Australians, particularly in the times we're going through at the moment. So I just stop and let's acknowledge that, because at the end of the day, that is why we're doing as we're doing. So Corinne, if we could go to the first slide, please. So this slide, thanks Karina. So this slide, I guess, is really just starting to put for us the context. Those of you who have heard me speak before know I kind of favour a way of looking at things where before you go to your content, you look at the context. And I think the context for Vision 2030 has a number of different aspects, but the first and obvious starting point for us in 2020 is the sheer physicality of what we have been going through in Australia. The physicality of coming off the back end of years and years of drought. And I know as we travelled around the country last year as we began Vision 2030 with connections, and we saw the real impact of that drought and how that in particular impacted on the psychological, mental health and well-being of Australians. And then of course we went into our our bushfires and our floods at the beginning of the year. And what a time that was. And I think what was really telling about those bushfires is not bushfires per se, we've been through that before, but the fact that they were so severe that they crossed state borders. So it wasn't a case of one state having a state of emergency. They crossed so many different parts of Australia. They were devastating in their severity. They shocked us all. They really shocked us. And then we had the floods that came straight after that. So that was just kind of like, wow, what is happening here? And then just as we were coming out of the bushfires in January, February, then we go into this complete unknown of the COVID pandemic. And we all take ourselves back to March when suddenly the whole country went into a time of significant restrictions where we were working from one place. For most of us, that was a home environment. We were living 24/7 with people. But if we were on our own, then we truly experienced the impact of loneliness, where we faced real fear of the unknown. It wasn't an anxiety that we could strategize away because we didn't know what the future held. We didn't know much about the illness, and we didn't know how to cope with the way we were managing the restrictions, which was being sort of so locked down. We probably about 6 weeks ago, thought we were coming out of it in a good linear way. We thought we'd been through the worst, and now we've got slammed again. For our colleagues in Victoria, our hearts go out to you. The challenges of the stage 3, stage 4 restrictions are just incredible around the country. We're seeing other pockets of it. As we live in Sydney, we see some of those fears coming through again. It's not linear, and we don't quite know now what the way out is. And of course, we've also been slammed by the economic reality of what we're going through. We're seeing record numbers of people reaching out for the impact it's had on their mental health and well-being. Thank goodness they are reaching out. But the numbers of those people who have been affected is probably as large as the Australian population. Then we put that, so that's part of our context, and I spend a few minutes on it because I think it is incredibly important. And it's incredibly important because a couple of things that have emerged from it is, firstly, there is this heightened awareness of mental health and the impact that these environmental things have had on our mental health. And I like to think that if there is one thing we can take forward, it is that recognition by more people that our mental health is an integral part of us. There's also been a real sense of people coming together, of that importance of social connectedness, that importance of doing things together. And I'll come back to that before I leave this slide, because then we also need to put into the context of the health reforms which have been going on now for some decades, in fact, and most recently through the work of the Productivity Commission and through the work of the Victorian Royal Commission. Productivity Commission looking at what do we need to do within our systems, the Victorian Royal Commission looking at what are the challenges from a user of a system perspective. And what are some of those challenges? Well, we know that our mental health system, for what it is today, is extraordinarily complex. Now, if you want a complex system to work well and be optimised, you've actually got to optimise each particular component of that system. What a challenge that is. Accessibility remains a very real challenge for Australians, not just accessibility into the system. How do I get into it? How do I navigate around it? But particularly for Australians living in regional and rural Australia, where services are very, very skinny, if I can use that word, and access to our mental health practitioners is really challenging. How do I get access to it? How can I afford the system is another one. And then as we do a deeper dive, what are actually the different components of care for our mental health system? That doesn't seem clear. And then we have this thing in Australia called federation. And what is federation? Federation means that we have 9 jurisdictions, 8 states and territories and the Commonwealth. And we have split responsibilities and split funding across all of those. We have the differences between our primary health networks and our local health districts or areas, between public and private health. What's the role of our NGOs? All of that is really challenging. And what we need to do is somehow bring that together under a framework which enables us to reposition the system so that it's person-led, so that it's person-centred, so that it's more responsive. Before I leave this slide and leave the context in which we're working, I want to draw our thoughts back to one of the other, I think, emerging opportunities that we have through all of the challenges of the pandemic and what preceded it, through all the complexities of our system at the moment. We see 2 things emerging. One is governments being much more prepared to work collaboratively together to find ways through. That's been something that's been of necessity as we've gone through the pandemic. So that collaborative spirit has been picked up, not only through social connectedness, but actually to how our governments are working, and there is a sense of urgency. And coupled with that sense of urgency, a sense of we can do things pretty quickly together. So that's the context in which we are, that we can now look at Vision 2030. Can we go to the next slide? So just a little bit of background about Vision 2030. It actually goes back a couple of years ago now to November 2017, soon after our Federal Health Minister, Minister Hunt, took responsibility for this portfolio. And I can remember sitting around a table down in Melbourne. He called together some stakeholders. And the suggestion was put on the table when the question was, well, what's working and what do we need to do? Of maybe what we need to do is to lift our eyes up from just the current scenario that we're sitting in and actually say, what would it look like if it worked properly? Because if it works properly, and if we can visualize that, then we can start to come back from that and actually start to create the steps to get there. So rather, I sometimes call it, rather than having what I call an emerging strategy of here we're sitting, what do we think we should do next? Let's visualize what it would look like if it actually works properly and then work back from there. So we were tasked with the job of somehow coming up with a Vision 2030. And right from get-go, the fundamentals that we said to the Minister was, we can't have a top-down visualisation, if you like, of what the system should be. This shouldn't be something which is just generated from a few of us in our offices, as experienced as we may be about the system. That's still just our view. So it is incredibly important for us to actually engage with Australians and with the community to find out not only what isn't working, but what would it look like, what would it feel like, what would it represent to them if it was working properly. And as we've worked through that, we've also acknowledged and welcomed the participation with the different jurisdictions. As I said before, our federated system of care means that there are parts of it which are being delivered by the Commonwealth, our primary care. There are parts that are being delivered by our jurisdictions, our tertiary care. That bit in the middle of community care is shared by so many. So we can't do this alone. And I think that's a really important part of Vision 2030. We can't do it alone. Vision 2030 covers the full spectrum of research, right through from research and prevention, early intervention, through treatment to recovery, all of the psychosocial components. It is a big piece of work, but we do need to do it in partnership with all Australians, with all service providers, and with all jurisdictions. Can you have the next slide? So there's a lot of work going on, and I know that we have many from the mental health sector with us today, so you'll be aware that there are a number of different things that are all being brought together at the moment. So we have, for instance, work that is being done around some reviews, and I've talked about that before. We've got the reviews of the 5th National Mental Health Plan. We have got reviews being done by the Productivity Commission. I think that's one that we all now are just waiting to see that final report. We have, as I said, the Royal Commission, and in fact it's not just the Royal Commission in Victoria, but we've had a Royal Commission into aged care. And that is showing how much we need to do still in terms of our older Australians. So there's a lot of that review work being done. There's also, as we come up the slide and go to the left-hand side, quite a lot of targeted work that's being done. Some of this has been generated as specific action items under the 5th National Mental Health and Suicide Prevention Plan, and some of it is other strategies. So if we look in the suicide prevention space, the Towards Zero National Suicide Prevention Plan is a big piece of work that is being done. I can step across just quietly into my suicide prevention advisor role and say, gosh, there's a lot more that we need to do in that space. Still sticking on suicide prevention, one of the targeted items under the 5th National Mental Health and Suicide Prevention Plan was to actually do, and there's so many words that go into these, but the Suicide Prevention Implementation Strategy, all jurisdictions coming together and saying, what is it that we could or should do? That document has now come together. It is a very big piece of work, and it has gone up through the processes now. Coincidentally, we're just in the process, as everybody knows, with National Cabinet having been implemented, that we're starting to collapse all of the old COAG committees and processes. So how we actually start to implement that is still a challenge, but the work has been done and it's been approved. We have the Children's Mental Health and Wellbeing Strategy that was announced about 12 months ago now as an incredibly important piece of work. As we look around the world, there's not a lot that's actually being done for children. So that's a specific strategy which is being worked on. There's the Preventative Health Strategy. Interestingly, mental health is not a specific component of the preventative health strategy. What that says to a number of us is we just have to therefore make sure that any of the work that we're doing in mental health, including this work in Vision 2030, must own that space of prevention. If it's not in that major part, we must bring it across. What is really interesting is that in the 10-year plan that the Federal Minister has announced, of the 4 pillars, and the 4 pillars relate to access to MBS and PBS. It looks at the intersect between private and public. It looks at the importance of research. It has as the 4th pillar preventative health and mental health. So I think if we're not in that preventative health strategy, we say we're still part of that 3rd pillar and we own that space. The workforce strategy is incredibly important. None of the work that we want to do over the next 5-10 years can be done without the right workforce. The research strategy, how do we make sure that we understand what should be being prioritised? We can't direct funding, but we can encourage funding to meet those areas of priority need. We have our Suicide Information Initiative, and we also have a workplace initiative. What can we be doing to resource our workplaces to understand mental health and wellbeing? What a lot of activity that somehow needs to be coordinated and brought together along with those systemic reviews to say, how do we work? And then as we're doing that, of course, things don't stop. We're already implementing some new initiatives. The adult mental health centres, or the adult mental health hubs. And alongside those are the COVID-specific response in Victoria of the enhanced mental health clinics, which are also being seen as hubs. So there's a concept of hubs which is getting implemented in the real time. There's eating disorder residential centres which are being implemented as well. So there's a number of different things in that implementation place. We somehow have to bring it together. Can we have the next slide? So what we need within Vision 2030 is to actually bring this together and to have a shared understanding of where we're trying to go. One of the things that has really struck me as we've worked through Vision 2030 is the absolute criticality of understanding what are our national standards, and I think we needed a critical piece of work on that, but most importantly, what are the outcomes that we're all driving towards? And that is a really critical piece of work that I go back to the underpinning way that we're doing Vision 2030, which is to bring us all together to say, let's get some agreement on that. We need to ensure, once we have those outcomes, that we have a governance structure and evaluation system that really says, are those outcomes being achieved? If not, why not? And who are we going to hold accountable? We need to do a really critical piece of work around defining what do we mean by the community care system. So we have our primary care, we have our tertiary care. We kind of understand those bits, and they're well served being underpinned by policy and really sort of quite specific frameworks. But the space of community, what we call community care in between, community-based services, is, as I've said before, just really shared by Commonwealth, it is shared by states and territories, it is shared by NGOs, it's shared by private health. So what is it that we need in there? What are the essential components of care that we should be delivering? At the moment, the way that community kind of section is structured, it really is the outcome of who has been successful at lobbying for what funding to do what it is they see as a specific need. No wonder people do postcode shopping to try and find what they need in community-based services. And then how are we doing the funding mechanisms that will really drive us towards and the outcomes that we all have acknowledged that we need. Next slide, thanks. So one of the things that we need to do in that whole framework, as I've said, we've got a number of things being reviewed, etc. And as I mentioned up front in the context slide, we have a number of specific reviews happening. But I think the review that is happening that has a really critical alignment with Vision 2030 is that which is reviewing the system, which is the Productivity Commission report. Vision 2030 is not about reviewing what services should we have. In fact, in many ways, Vision 2030 must be agnostic about what are the specific services. What we're looking at with Vision 2030 is that really foundational piece of what do we do to change our system so that the system does evolve into something which, as I said before, is responsive, is person-led, and is person-centred. Now, the Productivity Commission, we have the wonderful input of the fact that the Commission has undertaken this review, which is, I understand, one of the largest reviews they've ever done, and where after the preparation of the draft report, which was based on a few hundred submissions, they had almost 3 times that number of submissions in terms of, okay, now we've seen the draft report, we want to comment further. It's a critical piece of work. It has been delivered to the government, and I understand is due to be released, and we all hope that that is in the near future. But as we work on Vision 2030, and Vision 2030 is a collection of so much from so many people, we need to dovetail it in with what it is that the Productivity Commission is also telling us. So the final slide, if I could, thanks, Karina, which is to put this into a bit of a timeline. So what we've done to date, we started back, as I said at the beginning, when Minister Hunt asked us to do this piece of work, we said we must consult with Australians. So a number of you may remember our Connections Tour, which was underway really July, August, September of last year, where we went around the country. We visited 26 communities. We did town hall engagements with people. We met with service providers, and we did a survey for which we received a significant number of responses. So we've ended up with many touch points of information, and what the Commission team has done is really thematically analyse that to make sure we understand the fundamental principles of what people want, to understand what are those things which are stopping people being able to access and use the system at the moment, and to understand from their perspective what success would look like. And that has led for us to put together a blueprint which we presented to the Minister at the end of last year, beginning of this year, and are now taking up on a process of consultation which has involved the jurisdiction. So we have been in close contact and continue to work with the mental health commissions around the country, with each of the jurisdictions at the departmental level. I personally have met with each of the ministers, and they have said this piece of work, if we can get it right, could actually make a difference to how we have a system in Australia for our mental health and suicide prevention, which really delivers to those things that we need. We're right in the middle at the moment of doing the roadmap, and that's something that Francis will talk to us about. And just before I go, I want to say, so has it been useful to date? Yes, it has been useful, because I think everyone on the call, hopefully, is aware of our pandemic mental health and wellbeing response plan. We were called upon to do that in literally 2.5 to 3 weeks. It was an opportunity where that urgency and that collaboration of all governments came together, and with 9 jurisdictions coming together, we put together specifically a pandemic response plan for mental health and wellbeing. It was not the plan in which to do the reform, but having had the clarity and the input of the Connections Tour, the thematic analysis, and the work done to date through consultation on Vision 2030, we were able to just ensure that from a principles-based perspective, there would be alignment. So that pandemic response plan indicated just what we can do when we come together, when we work together, and when we have a shared, not only a shared understanding of what is needed, but a shared commitment to doing things together and doing things together that make a difference for those who need to work in and use the system. So I think I'd like to stop there, Frances, and hand back to yourself. But I'll just conclude by saying we really cannot do this without the input of yourselves. So I look forward to hearing further from Frances and the work that's being done specifically around Vision 2030, and continue to invite you, implore you, in fact, to stay engaged and to make this a vision for all Australians, because all of you have contributed to it. Thank you.
Thank you so much for that, Christine. And just while Karina does her background magic in swapping over various videos and screens, I just thought I would I guess, give a really quick introduction to what I'm going to do, because what I'm going to do is give what I completely understand is a whistle-stop tour, if you like, of the content of Vision 2030 to date, kind of across all of the phases that we've been going through, right from connections through to the roadmap that we're involved with now. And it goes alongside the blueprint document that's available on our website, and I do really encourage you to have a look at that, because we will be going through this a little bit quicker than perhaps we could do in depth. I also just really want to encourage you, and I can see some people already have started to ask questions in the Q&A section down the bottom. Even if we don't get to answer all of those questions today, we absolutely value those questions. We will use them to answer them as frequently asked questions on the website, but also questions that you ask during this session are really going to be able to help us as we progress, as we move forwards in being able to look at what should be included in roadmap, where priorities should be. So your questions are not only things that we can answer for you, but they're also really helpful for us in determining where we go next. So without further ado, I will move forward into our slides, and hopefully that will work. Okay, Karina, I'm having a little bit of trouble. There we go. Okay. So the first thing I guess I really wanted to go through is talking about the connections tour that we did back in July to September last year. It was really important for Vision to ground itself in listening to people's experiences, and so we did 26 town halls and 17 stakeholder meetings. We met with over 1,300 individual attendees, and we ended up with over 4,000 separate data points, and from that, we were able to really kind of look at some thematic analysis, to look at consensus building. What were the common issues for people? The data person in me really wants to point out that this is not necessarily a representative general population sample. Obviously, this is people who came to talk to us, people who had something that they wanted to say about their mental health, about their experiences of the system, about their services and their experience of delivering services within that system. So they're people that we heard, people who wanted to have a say with us, and that's what we've based this consensus building on. And what we found, I think, most interestingly, was that the barriers to seeking help, the most significant issues that people identified were around how they accessed services. They were around the services and the way that they engaged with them, much more than, say, for example, a specific service gap, which you can see there. There was sort of 25% of people identified a specific service gap in their area, but much more common, 50%, for example, said that access was their main barrier to seeking help. Obviously, that's financial, the cost of services, geographic capacity to access the services in their local community. Stigma and discrimination were the second most common there. So 41% of people, that was self-stigma and shame, broader community stigma and discrimination, both within the health sector and broadly within the community. And then trust. So the way that people engage with services, whether they're culturally appropriate, whether they've had previous poor experiences with the system, whether they are able to be confident in a service's capacity to provide confidentiality or engage appropriately with other services, was a really significant issue too. So 30%, almost 1 in 3 people that we spoke to raised that as an issue. And that's the across all of the town hall participants in all locations. So when you look at the barriers on the right hand side of this slide, those are more specifically related to the stakeholder meetings that we held. And although you can see some differences in what was identified by individuals at the town hall versus the stakeholder meetings, there are some similarities there that focus on systemic issues, focus on the enablers of the system as much as the individual components or services that are provided. So you can see systemic or structural issues, the appropriateness of services, the workforce to be able to deliver those services. The one that was also most commonly raised in stakeholder meetings was the social aspects. And for stakeholders, what that was defined as was the person accessing their services in context. So the other social determinants that might be standing in their way of being able to effectively access services, drug and alcohol issues, domestic violence issues, housing issues, things that we know are so closely reliant to people's mental health and well-being and the outcomes that they experience. And those were identified as barriers to accessing care. And then when you looked at people's experiences in terms of what they would like to see, their ideas for improvement, what we saw again, I guess as a consistent theme, was that systemic issues, systemic opportunities for funding, for services in the way that they deliver, standards for the workforce and being able to work to the top of their scope. Those were the issues that were most commonly identified as ideas for improvement, things that could make the system better. And again, I think it's just really interesting to note there that that's more than perhaps specific types of services, although those were also important. One of the things I think is really interesting here is that there was much more consensus around systemic issues, what needed to happen there around things like funding. But that service gaps, opportunities around maybe psychoeducation, social, hospital-based, were quite unique to community experiences. So whether that's community hubs, which was like mental health services, which was the most common, you can see at 39%. But the breakdown within that service was quite unique to the communities that we spoke to. So in some communities that looks like a single entry door of lots of different providers together. In some communities that was much more social focused, a connection to community, providing supports and recovery. So it really highlighted that communities have unique needs, and that while there are core components of how you might deliver care or what needs to happen in a community, everywhere was different and everywhere had different needs and everywhere had different ways that they would like to see things implemented. So whether you had the diversities, like I've just been talking about with the community mental health services, or whether you had what might have been defined as similar systems, so access to psychiatrists, for example, but the examples of how that might look in a rural or remote community, which we spoke to, versus a more metropolitan place that we visited, those were very different. So we heard quite a lot about fly in, fly out services, about the need for consistency in there and what it might look like to implement digital services to meet those needs, whereas that wasn't so much seen in the metropolitan centres that we spoke to. So even in services that might have been considered to be quite similar, the diversity in how people saw the gap and what might meet that gap or the idea for improvement was quite different. And then the stakeholders, I think, again, just really highlighted for us that there are big drivers in the system, in the workforce, in the how this has got done, as opposed to the individual programs, the bricks and mortar of which service was where. And although those things are absolutely crucial and they were raised too, and those are things that we've also looked at in Vision, I think it really set for us an agenda for what we would like to look at when we put together the blueprint for Vision 2030. And just lastly, so we did a separate survey online for those who weren't able to come to the communities that we visited. We've presented it a little bit separately because there are some differences in the way the question was asked that meant we couldn't really amalgamate that data. But I think what you can see from this slide is that there's similarity. There's a consensus across those two things. You can see there that 70% of respondents to the survey said that seeking help was too expensive or they couldn't afford it, and that was one of the primary drivers of barriers to accessing care for them. All of those numbers you can see are quite high. That's because people could pick as many responses to this question as they like. So it wasn't a matter of picking only one. But you can see there, if you look at the top, they are still systemic issues. How can service be affordable? How can people afford care? How can they create a system that is connected so that they're not repeating their story several times? What can we do to create safe and quality services consistently so that people don't fear what happens to them after they seek help? How are we creating local community services? You can see in the principles, services and supports that are available in your local community were the most common, the identified need or principle that they put most value on. So you can kind of see from the connections tour, and I've got a little summary on the next slide of the themes that kind of came out. And we found themes across 3 different levels: individual, service delivery, and system. And we basically, I don't think any of this would be news to you, news to people who've been working in the sector, but it was important for us to really kind of draw together and hear from people. And what we heard was that mental health is not well understood in the general community still, and that this results in shame and stigma and discrimination. And discrimination was one of the ones that came up really importantly. I can tell you from having looked at the individual data points that there was a real story that emerged of a growing awareness, a growing sense of perhaps personal interactions, people that are immediately connected to you having more of an understanding of mental health and more of appreciation, but that did not translate to an acceptance of the spectrum of mental health and the value of mental wealth and support for people who are experiencing mental illness, and that it did still result in discrimination. One of the examples that I recall from the data was somebody who had experienced a lot of personal support, but had subsequently said, you know, I don't think that I will ever get that promotion now. And I think that was what we really heard from shame and stigma, was that connection to discrimination, which was important. And in service delivery, I guess the key was that there's variability in services capacity to deliver appropriate quality care across the country, whether that's resourcing, whether that's duplication, whether that's rural and remote, or confusion about where to best access services, restrictive inclusion, exclusion criteria. There are a whole range of reasons for it, but the summarising theme, I guess, was that there was a real variability in people's ability to access appropriate quality care. And lastly, that the system itself is currently creating barriers, and that those barriers are in identifying need, in people being able to access services, in the coordination that's provided, and things being able to be accessible to everyone. So in equity, care is not financially, geographically and practically accessible to everybody right now. And it was in that context, with that platform, if you like, that we decided to build Vision 2030's blueprint. We built the blueprint, I guess, to align all of these things together, to look at it from a very agnostic perspective, if you like, to be able to identify what are the core components of a successful mental health system. What is the framework that we are looking at here, regardless of the current system, regardless of what services currently are or are not available, or what funding is or is not provided. We wanted that first step to be, what does B look like? What are all of the key building blocks that you need to create a successful mental health system? And we thought that we really needed to define that. Quite often at the moment, reform is worked on incremental improvements to A, what can we do to improve the things that already exist? And that's valuable, and that's how you get somewhere. But we really wanted with Vision to be able to identify B. Where is it that we are headed? What are the core things that we need to ensure exist? And then, as I'll talk about in roadmap when I get there, how do we get from A to B? So we submitted the blueprint, this framework, to the Federal Minister for Health in December 2019, and it is being used to be built upon and move forwards into the implementation roadmap. So I'm going to go through all of the aspects of Vision 2030's framework. It basically sets out 4 things, and I'm going to go through each of them in a bit more detail. But basically, it sets out some goals, the vision, if you like, for Australia in 2030 that encompasses mental wellness, whole of community, whole of life, and a whole of person approach to mental health care. That achieving those goals are going to require new approaches to the way that we address mental wellness and mental ill health in Australia. 2 particular new approaches that we discuss is an integrated wellbeing approach, so looking at social and emotional wellbeing as an integral part of what we might define as a mental health system, and a balanced community-based care approach that expands community-based care as a concept across the whole spectrum of care, and not as the bricks and mortar of a particular type of secondary service. And then to implement those new approaches, what you need is a system to deliver. So we go through a multifaceted kind of layered system of individual components. You'll see in a minute there, boxes, if you like, of what is needed to build a system to deliver those new approaches. And then the whole vision, I guess, is driving towards outcomes. It's driven by achieving outcomes for individuals, for communities, for services, for the country, and that care is underpinned by a monitoring and evaluation and review and research that is connected to those outcomes in a kind of continuous quality improvement cycle, if you like. And so we're going to go through those as a kind of like a logic thought process, if you like. If we've got these goals, we need new approaches. If we need new approaches, we need a system to deliver them. And if we've got those things, then we should be driving those things towards identified outcomes. So this is the list that's actually, I'm not going to go through this in great detail. This is the list of, I guess, goals, objectives, the vision for 2030 in Australia that's in the document that's on the website. Sorry, Karina, I think you might have just stopped my video. As long as everyone can hear me, I'll continue.
And I have stopped your video just so that everyone's screens can show the slides bigger so they can read the text.
Oh, great. Okay, excellent. I'm happy with that. So going back a little to just look at those. Karina, can you go back a slide? I seem to have lost control of the... Yeah, so this is the list of objectives, if you like, and I think the important thing here is that they encompass everything. They encompass everything from mental wellness and addressing mental health in its full social context, to addressing that people experiencing a mental health issue are respected and able to live a contributing life without stigma and discrimination, right through to how a system might work, a well-functioning and integrating system where people are able to play a central role in their care, where mental health is prioritised by all levels and sectors of government, and receives parity within the broad mental health and within the broad health and welfare systems. Sorry. And that successes are measured based on outcomes. So this is kind of, I guess, the starting point. If this is what we would imagine a successful system to achieve in Australia. And then going into those new approaches, we need to consider the wellbeing approach. And so there's two kind of components, I guess, to an integrated wellbeing approach. The first is the way that we view mental health, the way that we view how people approach mental wellness, and the way that it establishes itself differently. That it emphasizes that there's not just mental health, but there's the connection to social, emotional, spiritual, cultural, physical, economic, and mental well-being. And broadly, that there are differences in how those things are approached. There are differences in the meaning of mental health and wellness across different sectors within the community, particularly thinking about Aboriginal and Torres Strait Islander communities there, but even more broadly, there are differences in the way that we experience mental wellness, and that we need to incorporate those spiritual and cultural approaches. We need to incorporate how the social context of mental health is addressed, and that we need to focus on mental wealth and mental well-being across the board for the population, so population wellness measures. The other side of that then is the functional, how you functionally integrate. So part of the wellbeing approach is to say that those services that address all the things that I've just talked about, that address social and human services, physical health, mental health, need to be integrated. They need to be able to consistently and collaboratively promote wellness, enable prevention, and deliver quality care, and that there are connection points there. So we want those connection points to look at universal and targeted prevention, to look at what the physical health outcomes are for people with mental ill health, to address social determinants, to create touch points and entry mechanisms so that there are ways of identifying through social and human services and physical health care where people have mental health needs. To take a person-centered approach so that all of those things are looked at collectively for each individual, and that they are coordinated across portfolios so that there is consistency and care across the elements of a person's life. That we're able to look at what those things mean for priority populations, that information is shared across those things, and that crisis resolution is able to be delivered, overlaid across all of those things, so in an integrated fashion across those supports. So that's, I guess, a really key for us in Vision 2030 is to take this as an approach to all of the things that we're about to talk about, to all of the particular bits of the framework, that approach is integral to the way that we view mental health going forwards. The second new approach, and not new, I guess, but the second approach that we think is really important within Vision 2030 is a community-based care approach. And there we go. Sorry, I think there's a little delay on the slides. So basically, we wanted to be able to implement a balanced community-based care approach. We know that at the moment, definitions of community-based care are quite related to the way that they're delivered, where a kind of outpatient concept. And while that's an important part of what you might define as secondary care, we wanted to be able to expand that definition. We think that community-based mental health care is about everybody having equitable access to care in their own community, in the least restrictive environment possible, using a diversity of delivery mediums to meet local challenges and opportunities. And that this connects to a person, it puts that person in context. And there are kind of four different, I guess, considerations for us in implementing that community-based care approach. So the first is the system, that we actually need to facilitate a system of communities being involved in designing and delivering, determining care in their area. That is about creating accessibility and affordability for local services. It is about resource distribution, capacity building, actually creating environments where communities are capable or able, have the resources and infrastructure to be able to deliver services locally, in whatever that looks like. And as I said, diversity of delivery medium is important there. And a sense of local or collaboratively local control. that there are practice principles, and I think this is the bit that people quite often think of when they think about, you know, how you might approach balanced care. Obviously, person is acknowledged, supported in their own context. That means connection and continuity. It means working with their strengths and goals, being recovery focused, culturally appropriate, person-centered, involving family and carers, that you put the person in their context. That care is delivered in community-based settings across the spectrum. So the delivery of care looks at community and home-based across all levels of intervention, whether that's early intervention and psychoeducation through to you know, intensive supervision type services, hospital in the home, for example, that it's not just a particular individual service, this is the community service, but that community-based care is facilitated across the spectrum. And that all aspects of the system work together, right? So that there's an interoperability of the systems that enable a community to deliver, that there is a information sharing, that there are pathways, there's a collaborative approach, and that collaborative approach is supported, incentivized separately to the services that are delivered. And I know that's a really, really fast version of what that looks like. There is a lot more detail in the document on what we mean by community-based mental health care, but it really is one of the two key drivers, the two new approaches to then how we look at the system components. So this is the kind of, I guess, catch-all diagram of all of the components that you'll see in the Vision 2030 document. It includes a whole range of different specifications and particular building blocks, as I said. It goes from principles right through to outcomes. And what I'm going to do is go through each of these in a little bit more detail. So these are the principles that we identify in Vision 2030. That these are the principles that drive all of the work that comes afterwards, if you like. They're things that we have determined to be important as overarching to the rest of the system. I think most of them are kind of self-explanatory, but I'll go through them really quickly. So basically that the social and emotional wellbeing approach that we just talked about, the recognition of lived experience knowledge, and that is central to policy planning, practice and participation, that people with lived experience, both consumers and carers, are engaged in all aspects of their care, as well as leading and designing, delivering and evaluating programs. Then we have equity and equality. So taking a rights-based approach to mental ill health, acknowledging that equity and equality in health is a basic human right. So taking a human rights approach to mental ill health. Recognising the importance of intersectionality, and again, that person in their own context. So recognising that people's experiences are a complex combination of their environment, themselves, their identity, and that those complex interactions can heighten vulnerability, that they can have a significant impact on people's wellness, and that they need to be considered. People cannot be put in boxes, is the fundamental underpinning of that principle. Partnership and collaboration, so that you know, across health, across other sectors, within communities, we need to be able to deliver using resources effectively, being cohesive and coordinated. So just a principle of partnership and collaboration across the system. The balanced community-based approach that I've just talked about. Flexible solutions, so being outcome focused, relevant to current circumstances, relevant to a local community, being able to be responsive and adaptive and change the environment. I think we have seen so incredibly clearly with the current pandemic, the need to be able to be flexible in changing how we do things to achieve the same goal. Innovation, you know, wanting to be able to move forwards. Creating the building blocks for a system doesn't mean that we stop and stand still, that there is a principle of constantly being able to use best new information to better meet needs. Best practice care, obviously, being recovery oriented. So acknowledging that recovery is a non-linear journey and unique to each individual, but an important principle to be able to implement across the spectrum of care in ways that are meaningful to those individuals, and trauma-informed approaches, so that a system and care components that can recognise the impact of trauma for individuals, for families, communities, and create a culture, I guess, of safety and empowerment. So I guess just looking at outcomes and impact, what we really mean, I guess, is being able to measure. So we need data. We need data. We need monitoring. We need to be able to look at that data, have frameworks in place, agreements on what we're achieving, what we think we should be achieving, what those outcomes are. Being able to measure them with data sets on mental health attitudes across the community in terms of stigma, individual outcomes, community outcomes, population outcomes, both for those who are receiving an intervention, but also from those population wellness measures that we were talking about before, and evaluation, so that it's an integral part of each component of the system, and for the way that we look at the system, so that we are really focused on translation and real world effectiveness, that piece where we actually move innovation and evidence into practice. You'll see down the left there a list of outcomes. These are example outcomes of what we might be looking at focusing on for Vision 2030. More work is being done on that list in the roadmap. So this is not a complete or final list, but it's examples of things that we think will be really important to measure effectiveness of the mental health system. And while you can see some things in there that relate quite specifically to ill health, so decreasing rates, improving quality of life, increasing early help seeking, so access to earlier treatments, you can also see in there that there are some broader cross wellness, I guess, aspects in terms of having housing stability and employment for those with mental illness, decreasing engagement with corrections for those with mental illness, improved child development and wellbeing measures, and the national attitudes, so demonstrating understanding and acceptance at a national level as well. So those are things that we're working on within the roadmap. So that top line there was governance structures. And rather than go into what's in all of those, because as I said, each one is quite specifically addressed within the document, quite detailed. What I thought I would do is just go through what the purpose of this particular component within the structure is. And I guess for governance structures, it's about creating that national foundation, a strong base from which local solutions can be drawn. One of the things that's really important within Vision 2030 is that we're creating one system with many thousands of solutions, not 1,000 systems. And that's really important. So this governance structure piece really creates that consistency and clarity where everybody should know what is expected. There are agreements to establish how the system is implemented and the best use of resources. So they will decrease duplication. These things, in terms of standards and specifications, leadership, the agreements, they will model what's needed and create those standards that allow for flexibility. Sector capacity building, so being able to actually generate a community-based system, acknowledging that the system is greater than the sum of its parts, and that part of the governance structures is facilitating a system that can deliver the services that it needs to deliver. Obviously, it's about sustainability, so creating a system that can improve and adapt and innovate, and recognising. So that investment piece is really about recognition of the value of mental wealth and social context, breadth of needs. So you can see all of the individual components listed up there. We need national agreements, formal leadership, investment, and in investment, you can see in the document, we talk very much about mental wealth, about early intervention and prevention and whole of population, standards and specifications, including tools for how things might be modelled for local service, and community design and delivery as an actual structure. So what does it look like to enable local, from states and territories through to regions and communities, what does it actually look like to deliver that care? And then the next one, there we go, performance enablers. So really this green section here is about the capabilities, the forces, the resources that contribute to the success of the system, and how those things work together, how you facilitate a person-centered approach within services. So these enablers look at how do you actually integrate services? What do we mean by a multidisciplinary workforce, and how do you create a workforce that are able to work to the top of their scope. You'll see if you look at the document, when we talk about things like multidisciplinary workforce, we talk very much about the work that needs to get done, not necessarily specific roles that will do different things, but what that looks like. But what we do focus on is the diversity of that workforce. So when we talk about things like career pathways, credentialing, formalization of a workforce, but also being able to work to top of scope and work together, then we are talking about a clinical workforce, we're talking about a lived experience workforce, we're talking about allied health, we're talking about what frontline workers. So you'll see from the document, we've taken a very broad approach to what a multidisciplinary workforce is. And then we've got things like research and evaluation and data and information. So this is the resources, the forces, the capabilities that aren't just about the services and the systems, but how this gets done. Funding models, priority populations and age streams are up in here because they are overarching, because it's not just about this is a service for young people or this is a service for children, but actually there is a requirement to look at the whole system. It is a performance enabler, a resource and a capability to have a whole of system view of what does this mean for people who identify as LGBTIQ+. What does this mean for Aboriginal and Torres Strait Islander communities? What does this mean for older Australians? So you can see that we've identified some priority populations. We've broken down the age streams into children, young people, general adults and older Australians. But you can get a sense from there that what we're talking about is that it's not just about an individual service that's delivered to that population, but how are those things addressed across all of the core components of care. Which brings me to the core components of care. So what this blue section does, if you like, is identify all of the essential groups of supports and interventions. It's not about services, as I said at the start. It's very much about being agnostic, but identifying the key things that are needed. And that's not just within a whole service system, but it's within each community. These are the things that are needed to create a framework for planning and coordinating at those local levels to ensure that all of these things are accessible and available to people in their own context. It creates an individualized and personalized connection between those boxes. So it's not this box happens here, this box happens there, but it's about identifying all of the things that need to happen. Obviously, we've got wellbeing measures, primary healthcare and community services kind of along the top, at the top. I think, again, you can look in the document to get a lot of detail on what we mean by these individual boxes. I would just highlight a couple that I think might be slightly different in Vision 2030 to perhaps how they might be determined in other places. The first is crisis resolution. So crisis resolution being a particular coordinated set of supports and interventions that are about intervening for a person who is in a mental health crisis at risk of suicide, for example, at risk of harm to self. And it's about how can, again, taking a community-based approach, we resolve that crisis. So from an immediate intervention, 24-hour response services, safe places to be in a community, through to coordinated aftercare, postvention that isn't necessarily just connected to an emergency department, but is a separate and integrated service that looks at the whole spectrum of crisis through to resolution, which was important for us. And then the other one, I think, is carer and family supports as a unique and separate component of care, acknowledging that carers and families play a crucial role in all components of care as part of a treating team, but that their varied nature of caring roles and of being part of a family for particularly children and young people, that those things require their own separate supports, that there is actually a specific type of care that a carer needs, and that's been included as a separate component of care. And that does kind of lead me into a little bit, I guess, about the way that we've looked at the stepped care model. So we've adapted the stepped care model a little bit, I guess, to try and reflect those things that you've just seen in those core components of care. So we've included the step that is support to lead a healthy life, socially and emotionally, that everybody can benefit from. We've included a step that is support to help care for someone with mental health concerns. And then we've got mild mental health needs, moderate mental health needs, high intensity and complex needs, and life-saving and crisis supports. while we have continued to call this a stepped care model, I think we really have moved into calling it a spectrum of need. You'll see in the document, we talk about what it looks like to have the ability to move seamlessly, to focus on a whole journey, and prevent illness progression along that spectrum, and promote recovery. Not so much step in and step out, or step up and step down, but walk along, I guess, in that person's journey. And obviously that's something that needs to be supported by tools that allow for monitoring and assessment and feedback of interventions to be able to plan for an individual along that continuum. And you'll see one of the blue boxes was a continuum of care planning and coordination. And that really covers from navigation and help to engage from a very low level through to complex care coordination that follows along with a person, allows for personalised care, that allows for drawing in not just mental health services, but social supports, housing, employment. So there is a kind of sense of that coordination and monitoring to plan future interventions for people along that spectrum of care. And I'm going to skip over the next one just because it's really just putting those two things together, all those core components and the step care model. And I am conscious that I want to try and leave some time for questions at the end. This is available in the document, so you'll be able to look at this in a bit more detail if you have a look at the document on the website. And again, this is just kind of an example of what that looks like for a person. And the orange you can see is very much about universal. So it's really trying to create a journey that includes the things that happen for a general population wellbeing measures, acknowledging that there are front doors and that there are no wrong front doors. Those things are connected to each other. That there are specialised services that care planning and coordination creates pathways to as early as possible, and that there are, in the purple there, support services, so psychosocial and recovery supports, carer and family supports that sort of span a person's journey depending on need. And again, you can have a look a lot more detail at those diagrams in the products that we've got available. And then the last little bit, so the little orange strip down the bottom of our arrow is delivery mediums. So one of the things that was really important for us is to separate out how a component of care is delivered from what care is needed. One of the things that we found when we looked at current funding mechanisms and the way that services are currently set up is quite often the delivery medium is the thing that is funded, and then that kind of dictates what services are provided. And we really wanted to tip that on its head and say, what is the care that is needed, and then how best could you deliver that to an individual community, knowing that in some places that's going to be different. And we've seen with the introduction of telehealth how important for rural and remote communities a more diverse use of digital and telehealth has been in accessing care. So it's not about the same type of delivery medium for the same type of service everywhere. It's about connecting the dots for an individual community to say which of those core components of care can be used together through those delivery mediums to deliver all of the spectrum of care within a person's community. So the sites of service, if you like, and a flexibility to address local needs and barriers. And obviously grouping core components of care to create coordination within some of those delivery mediums as well, that all focus on community support. And again, I think having those delivery mediums separate has been part of the focus on how do we deliver services within people's local contexts. And so that's just really a summary of where we've kind of got to, how Vision's key components, I guess, kind of sit within what you might define very loosely as a logic model, how we've worked from our situation and identified it through to what the objectives are, so the vision and the principles, the resources for the system in terms of the governance and performance, the core components of care and delivery mediums as the actions, the actual service, how things are delivered, working towards those agreed outcomes. And what that brings us to then is where we are. So we are at phase 3 of Vision 2030. We are at Roadmap. Roadmap is designed to create implementation pathway for the Vision 2030 approach and framework. It's designed to coordinate a sense of how we get from A to B, now that we've defined what B might be, and connect Vision 2030 components to current activities, current drivers of change, so, and So, for example, recommendations that might be made out of some of the reform activity currently underway. It explores what those look like, and it creates a pathway and a set of priorities to understanding them in the context of a whole system. So you're able to look at the recommendations that come out of things like the Victorian Royal Commission, the PC, the strategies that are underway in terms of children's strategy, workforce strategy, and see how they connect to achieving the whole system. And identify where there are gaps, where the real specific targeted work in reform so far may have addressed some areas more than others, and where there might still be gaps, to be able to look at the system as a whole going forwards. So roadmaps, seeking, I guess, to enable change. It's not necessarily about making 40,000 very specific recommendations on each of the framework components that you've just seen. But it is about trying to promote structure to all of the reform that's there, fill gaps where we have opportunities to suggest things that may not have been suggested, and sequence, so promote early action where possible, looking at what are the overarching priorities, what can be done immediately or must be done first. So that can be a combination of quick wins, but it can also be a combination of building blocks. So, you know, what is required or is dependent on earlier change. I think the telehealth and rural and remote is a good example. So if there is a part of the system that requires an increase in availability of local services in rural and remote, then you have steps along that way that you need to pathway. What does it look like to create the workforce for that? What does it look like to create digital infrastructure to enable that? So Vision's roadmap is more about connecting those things and creating those priorities, and how can we engage those current reforms and recommendations towards the whole of system change to keep it connected, to be the umbrella. In talking to somebody the other day, they reflected back to me a sense of compass, that it's the compass or the map, if you like, that can show how to pull together those pathways to still head to the right direction, even if there might be different vehicles that we use to get there along the 10 years, or different ways to achieve a pathway, that there is a compass that says this is still where we're headed, this is broadly what those priorities are, and how you stage those things out. So this is what we've kind of done to date. We've been working on roadmap during this year to look at addressing each of the aspects of vision, adding some additional drivers, so looking at it through lenses of things like policy and legislation, administrative arrangements, being able to look at communications, the services and programs that already exist. We do totally acknowledge that once you've defined B, you still need to get there from A, and that we do have a current structure of systems. There are opportunities and needs in that current system to be able to deliver a future Vision 2030. There are also a whole heap of drivers that are obviously already part of Vision 2030's components. So when you look at things like research and data, modelling, those types of things. And then that basically moves towards roadmaps. So we've looked at summarising what the current circumstances is, the objectives and outcomes, which is really some of the stuff that we've just talked about in the blueprint, where the opportunities are from current reform recommendations, then what actions should be taken against each of the core components of Vision 2030, where the overarching priorities are, and as I've said, how you produce the way forward with all of those together. And this is very much something that we are trying to produce together. It is very much about us trying to create an environment where everybody's working towards the same outcomes, with the same vision, with the same end goal in mind. As Christine mentioned at the very top of the session, this is something that we are working through with jurisdictions, that we are working with the other reform agendas and activities that are going on to be able to work together towards the vision. And so one of the things that I think is really important to point out here is that we've been able to pull all of those things together, from people's submissions, the public submissions to the Productivity Commission, their draft report, submissions to the Royal Commission, the connections to the other National Mental Health Commission projects that have been doing consultation. all of those inputs have been put into Vision 2030 or are being put into the roadmap at the moment. And I appreciate so much the fatigue that is on at the moment I feel it personally, as I'm sure you all do, from the way that we work at the moment, but also just that it has been an incredible amount that the sector have given in terms of consultation. The input, their expertise, their advice, their experiences, people's lived experiences, all of those have gone into such a huge amount of reform at the moment. And we are not seeking to just replicate that. We are seeking to absolutely take that on board. But what we would like to take on as the next step for us, the next step in the journey to create this roadmap, is to provide an opportunity to engage with us on the roadmap's key concepts, to look at opportunities to provide input and feedback on what those key concepts are, on what the priorities should be, on how we interpret all of the things that have been said, all of the diverse recommendations, so that we are all on the same path, so that we can prioritise. I think the sector have incredible insight into what that looks like, and that, I think, is the piece of the consultation puzzle that we would like to ensure we meet as our next step for roadmap, in developing roadmap. We want to be able to develop the final product for the end of 2020 so that it really is available and ready to use as those reform activities complete and make their recommendations. And as we start to move, it's designed to guide those investment decisions and things like that. So that is our next step. That is what we're hoping to bring everybody in along on the journey for over the next few months. But I really wanted to just take that moment to acknowledge how much work has already gone into consultation from the perspective of those who have been consulted, and how we are using that information, and how we are trying to create a next step of consultation that is about fitting those missing pieces and being able to prioritise rather than rehashing things that have already been provided to so many of those different things that you can see there on the screen in terms of consultations. So that's kind of it. And as I said, I appreciate that it is absolutely the whistle-stop tour, and I appreciate your patience in this format, meaning that it's incredibly didactic in me just talking to you without even being able to see me. But we will be able, we've got about 10 minutes to answer some questions, which I'll go into and start to do now. We did also get some questions prior to this through the surveys that some people submitted. But you will be able to find out more about this next step of consultation and engagement activity that we'll be doing from the website. We will also take all of the questions that you've asked. I can see that there is a whole list of, oh, you're going to be able to see me again. There is a whole list of questions that I can see there. So we will go through those questions. We will answer them as best we can on the website and use them to fuel how we look at things going forwards. But I'll start to just pull up a couple of the questions that I can see, and appreciating that there are quite a few, and we are getting quite close to the end of time. But one of the first questions I can see there is the question around older people. So how is mental health for older people being given a priority in Vision 2030? And so I think I'm kind of hoping we sort of really touched on that before, but what we have done is created a stream, so a stream for older Australians in mental health. So there's a stream for children, a stream for young people, a stream for general adults, and a stream for older Australians. And what that does is create a requirement on the whole system to address the mental health of older people in all of those core components across the spectrum of need, looking at the delivery mechanisms that are going to be most appropriate to them, whether that is within residential settings where they might be living or within their community. It has to address barriers that they might have in accessing, that means that perhaps delivery mediums might be different for the services that they need. So the fact that we've identified it, although it might seem like a small component of care within the big vision framework. It's I guess one box to say there has to be an All Australians stream of mental health care. I think that addressing it in that way means that as we implement and as it goes forward, Vision has set an agenda that says that older people's mental health has to be addressed at all stages. It's not just a one box that there is a particular type of care provided in residential, but that it is across all of the spectrum within community-based care. One of the other questions that we got before this session in one of the surveys was, why are specific professions not mentioned within Vision 2030? And so if you look at the blueprint document so far, you'll see that there is an identification of the variety of professions that are involved in a multidisciplinary workforce. And we identify particular types of service in those core components of care that are traditionally provided by particular professions. So the fact that primary care has such a huge role to play in those core components of care really identifies GPs, for example, as being central. But we've really tried to focus on what is needed in those core components of care, and that's separate to the how is it delivered. And we acknowledge that there are different ways that things could be delivered, that there are values of different professions that relate to the individual practitioner as much as they relate to a profession. So there are GPs who have additional training in mental health and an incredible wealth of knowledge in mental health who may play a role that's different and extended to what you might typically define as a GP role. The lived experience workforce is not just about peer support and a singular box. There are valuable roles for a lived experience workforce to play across the spectrum of care, from crisis resolution through to recovery supports and early intervention, even in prevention. So we've not done that in the state of Vision so far, because it is about looking at what needs to be done, not necessarily who specifically does it. Having said that, roadmap is totally acknowledging that we need to get from A to B, that we have current workforces, and so does identify what needs to happen for some of those specific workforces and how they might be used within that system to move forwards, as do a lot of the recommendations of some of the other things that have been coming out, fifth plan and you know, various other pieces of reform work. So there's one of the things I can see, I think, is quite a few questions on specific services, specific models, or even individual programs. And I guess the answer for that is quite similar to the professions, that the framework is designed to identify what the core components are, the core requirements. That could be delivered by a great many different services, provided they're meeting those enablers of research and evidence base and standards and specifications. And so again, it's not part of the compass, but absolutely is part of the current service system. And to be able to get from A to B, we need to know how to utilize those things. So it's not in there for that reason right now, but I encourage everybody who's got those specific questions to engage with us on roadmap and in those next steps to talk about what that might look like. I think, so looking through at some of the other questions, I can see that there's some specific questions on how drug and alcohol fits within this system of care. And you'll notice that drug and alcohol wasn't a core component box within the blue boxes of mental health care. But we have done a lot of work on how mental health and drug and alcohol integrate as very aligned but separate services, in the same way that there are very aligned but separate needs when you look at suicide prevention and mental health. We've just completed a project specifically looking at drug and alcohol integration with mental health, what the needs are from the drug and alcohol sector's perspective. And that will be included in the roadmap as part of the integrated wellbeing approach. There are specific recommendations that will come out of that actually talk about how do we ensure that those things are integrated so that the person experiences them seamlessly, while acknowledging the diversity of services that are in drug and alcohol supports that are separate to mental health. So we are absolutely addressing drug and alcohol as part of that, and I'm really pleased to be able to say that we've got that content directly from the drug and alcohol sector to be able to see what best works for them as well. So I can see a couple of questions around who stakeholders are, I guess, within this, and there's that's a really big, I guess, a question, and I think Vision 2030 identifies a really broad range of stakeholders that need to be involved, but that if you look at the principles, I think one of the things that we've identified is that stakeholders are need to be involved at all stages. So if you look at the kind of pyramid of stakeholder engagement, from governance and leadership through to design and participation, consultation and informed decision making, collaborative work and communication and being informed. One of the things that we've really identified for Roadmap and Vision is that those things need to be cross-sectioned with groups of people who are impacted. So people who have their own lived experience, carers and families, clinicians, researchers, government need to have representation at all of those levels within the pyramid. They don't sit separately at different points. So it's not that there are particular types of stakeholders that sit at a governance perspective. There are not specific stakeholders that sit at a communications perspective, that every identified group of stakeholders that is involved with mental health care has an opportunity to participate sort of along that pyramid as well. One of the things that Vision 2030 identifies is a sense of whole of governance as separate to, but including what you might define as whole of government. So we really want to be able to take a position where those who are impacted, those who are delivering the system, have a role to play in the governance and direction of that system. So we've taken a whole of governance approach that includes people with lived experience, community managed organisations, private health. There is, if you are a part of delivering the service, then you should be able to be represented at all of those different levels. Sorry, in the pyramid of engagement. So I'm conscious that we've just got 1 more minute to go, and I can see there are so many questions that have come through. So rather than try to do a disservice to one of those questions and add a 50-second response to it, I think what we might do is finish up there, but we will take all of the questions that we can see there. We will do our best to answer them in frequently asked questions, in correspondence from the interest register, and as I said, your questions I can already see really show where those priorities might lie and are a good first place for us to be starting those consultations on priorities. So I guess that would just be where I would leave everybody in saying thank you so much for joining us today and for sitting through a very intense hour and a half of people talking at you. It was just really, I guess, important for us to be able to put some context, some clarity to the document that you can read on the website and prepare the way to be able to talk meaningfully about Roadmap going forwards. I really encourage you, if there's anyone who hasn't signed up to the interest register, to sign up because that would be a great way to keep in touch and to connect with us as we start any of those consultation processes. You can see there on that slide too is the team email address, so please do also feel free to email the team if you have any questions that you didn't get to ask in the session or want to follow anything up, have any problems finding things on the website. The team would be happy to chat and help. And yeah, I guess that will be the start of the next step in the Vision 2030 journey. So thank you all for joining us.